Hi everyone, here in front of you is the beautiful composite model of all the tracts of the spinal cord. If you look around, you can even see that the individual nuclei of the brainstem and the individual tracts of the spinal cord, everything is included here. Overwhelming, isn't it? But that's not going to stop us from learning the neuroanatomy. I have shown the details of corticospinal, spinothalamic, and the dorsal column tracts in detail. This will be shown in the upcoming videos, where I have not only isolated the individual tracts, but I have also isolated the details between the brainstem and the spinal cord so that you can easily visualize the structures and compare that with each other for a better understanding. For the individual tracts, you can see that I have used different colors, like the corticospinal tract is in blue, the dorsal columns are in purple, spinothalamic in red, and the cerebellar tracts are multicolored depending on from where they come. Let's look at some of the details of the section of the spinal cord. Maybe I'll choose a section of the lumbar region. As you know, this is the gray matter and this is the white matter of the spinal cord. Here is the anterior side by convention in the anatomy textbooks. Here is the posterior side, or in other words, ventral and dorsal. You can make out that the anterior horn is wider, whereas the posterior horn is narrow and it reaches till the circumference of the spinal cord. Okay. What I need to know here is, on the lateral side, there is a huge tract called the lateral corticospinal tract, which will stay in the same place throughout the spinal cord. But for now, you remember, there is also an anterior corticospinal tract which stays in the anterior aspect, more towards the midline, because the fibers will supply the midline of the body, which is your trunk. Coming outside, along the boundary of the gray matter, you will see a long tract that's called the lateral spinothalamic tract, which is responsible for pain and temperature sensation. On the dorsal aspect, which is the posterior aspect, we have a couple of tracts called the dorsal column tracts. But because they form at different levels, in the lumbar level, you will only see the so-called gracile tract. So you are seeing one big lump of tract here. At the far margins, of course, whatever detail I'm telling, it's on both the sides. The far margin towards the circumference, you will see the cerebellar tracts. Towards the posterior side is the dorsal spinocerebellar. Here is the ventral spinocerebellar. The other extrapyramidal tracts are not shown here, just to keep the discussion simple. Just one additional feature, you can see that the tip of the gray matter is formed by the substantia gelatinosa. However, if you go to the thoracic spinal cord, the major difference you see is the presence of a lateral horn in the gray matter, giving rise to the sympathetic neurons, as we know. The rest of the details are all same. Spinothalamic in the same place, corticospinal in the same place, both anterior and lateral, spinocerebellar in the same place. But you can see that because we are in a higher level now, there is an additional tract joining the dorsal column tracts, that's called the cuneate tract. You will see a similar appearance in the cervical spinal cord also. When I compare this cervical level to the sacral level, for example, you can notice that in the cervical level, the gray matter is smaller or narrower with lots of white matter tracts. But in the sacral level, you can see that the white matter tracts have come down. They have been sent off to supply the respective regions. So lower down, the thickness of the white matter tracts is very thin, appearing as if the gray matter is huge. So that is one of the regional differences you can see between the proximal levels and the distal levels of the spinal cord.